Well, according to the U.S. breast cancer statistics, about 1 in 8 women will develop breast cancer in her lifetime. An estimated 252,000 cases are expected to be diagnosed by the end of this year. So today we're talking with Dr. Ann Koberman, board-certified breast surgical oncologist. Thank you for joining us this afternoon.
Thanks for having me.
All right, let's start with mammograms. Do you find that women are at the point where we're realizing that everyone realizes that they're good for you and they work?
I think for the most part, I think there's a lot of confusion on when people should get mammograms and at what interval, and that still comes up a lot in my patients and questions. And we generally recommend you should start at age 40 and be yearly thereafter, unless you're at higher risk and may want to start kind of screening earlier. But I think for the most part, women are accepting of the technology.
They've got the message.
Yes.
Because you've been preaching it,
yes.
and that's why you're here today.
Absolutely.
So, all right, let's talk about what happens in those cases where maybe women may need to be treated earlier or get a mammogram earlier than age 40.
So that's going to be an individual case-by-case basis. So we look at personal risk factors, family history risk factors. If you have family members that have developed breast cancer at early ages, that would be one of the cues. If you have a genetic mutation in your family, that would be a reason that we might start mammograms early. But for most women, the vast majority are going to be starting at 40.
Okay, so when you see them at 40, and we're talking it's their first mammogram, what are the things that they should know about going into their first one?
Absolutely. So the big question is whether or not they should have 2D or 3D mammography,
okay.
And that's the big kind of new development with technology. 2D was the kind of two images. You have one from top to bottom and one
right.
kind of side to side that we were used to do routinely. And now we have the opportunity to do 3D where we can actually reconstruct the entire breast. And we really encourage especially younger women to get that 3D mammogram because it lets us look through their denser tissue a little bit more effectively so we can find cancers earlier, smaller, and not have to call them back for as many kind of additional pictures. Interesting.
So with the statistic that we just talked about at the beginning of the interview, 252,000 women will be diagnosed with breast cancer by the end of 2017. We're making progress, but are we making it fast enough in breast cancer research?
I think so. I mean, I think that we are doing a very good job diagnosing patients early, and that's where you have the best chance for long-term survival. And that's where screening, clinical exams, self-exams, and certainly mammography, because they're all looking at different things, really help us achieve that. There are a lot of clinical trials and a lot of breakthroughs in terms of personalizing medicine with genomics, better options for adjuvant therapy, meaning treatment after surgery, and all of that is continuing to improve all the time, and a lot of that's due to the research we're doing.
Well, I appreciate your optimism. There is room for optimism in this scary cancer.
Most breast cancer patients become survivors.
Good to know.
Yeah.
That's awesome. Dr. Ann Koberman, thank you for coming in today. We appreciate it. And for more from HCA Midwest Health, just go to kctv5.com and click on the Lifestyle tab. All right.